cut Medicaid over the next fiscal year has a lot of people concerned. So joining me today is Stacy Wilson. And Stacy, you're the president of the Children's Hospital Association of Texas. Welcome to the show.
Thank you for having me.
All right, so kind of tell us a little bit about Medicaid. We know that it covers about 30 million children nationwide.
That's right. And in fact, half of the children in Texas are either on Medicaid or CHIP, the Children's Health Insurance Program. So it gives them access to coverage and care that they need to be healthy.
You know, Texas stands to have the biggest funding cuts here if this happened. Kind of tell us why about that.
Sure. So Texas obviously has a lot of children, and so we just recently had a report that came out that shows that we're going to be cut over 6 years, $5.2 billion, and that's for healthy kids, so non-disabled children. Those cuts are going to be huge. It's not going to impact children, and they're not going to be able to get access to the care that they need.
You know, a lot of people don't know this, but there are some benefits to children who actually that are on Medicaid. Kind of tell people a little bit about that.
Sure.
As well.
So children can get preventive care. So like you go get your checkup with your kids. Children are able to do that through Medicaid. Plus it covers things like organ transplants, you know, cardiac surgery. If your child is born early, you get to be in the neonatal intensive care unit, and all of that's covered by Medicaid.
You know, for people who don't know what your hospital does, you guys actually deal with children that have kind of complex health issues. Kind of tell us about that.
Sure. So one of the interesting stories that I saw was a baby was not going to be born healthy, and so they were actually able to go down at Texas Children's and inflate in utero the baby's lungs so that the baby was born healthy. That baby would have had lots of health problems without our ability to be able to do really complicated surgeries like that.
All right. Well, Stacy, thank you so much for all the hard work that you do there. We appreciate that. All right. Well, coming up here on Midday, there's a